and welcome to A Deadly Silence. I'm your host, Larry Curtis, and it is our goal to expand on the education and awareness of both the drug and alcohol addiction that has affected the city of Brockton and the surrounding communities in the South Shore. Today, we have with us a guest from the Brockton Mayor's Opiate Overdose Prevention, Hillary Dubois.
Hi.
Hillary, welcome to our program.
Thank you for having me.
Could you tell us a little bit about the Mayor's Office of Opiate Overdose Prevention, I'm sorry.
Absolutely. We are a program that is funded through the Department of Public Health's Bureau of Substance Abuse Services. Basically, the state of Massachusetts was looking at the rising and consistent numbers of fatal overdoses through the Commonwealth. And so the way they reacted was they applied and received federal funding to work solely on reducing the number of fatal overdoses in the state of Massachusetts. Brockton was one of 15 communities that was selected for this grant, and it's a 3-year grant. And my sole job, my 40 hours a week plus position, is working to reduce the number of fatal overdoses in the city of Brockton.
What year are we in with that grant right now?
We're in year 3, so we've got hopefully another full year through supplemental funding through the government.
Okay, and I'm assuming there are people behind the scenes trying to get additional funding to keep this vital program going in the city.
Absolutely, it's very important, and we've done a lot, but there's still a lot of work to be done, certainly.
Absolutely, positively. So tell us about the program.
Sure. Basically, what my job is to go throughout the city and educate people, give out information, create awareness. I've worked with the Brockton Police Department, I've worked with Brockton Fire Department. We have a staff who works in the Brockton Hospital emergency room who helps facilitate getting people who have suffered from an overdose, getting them some services. I work with the Brockton Public Schools, I've gone into the mainstream high school, I've gone into the alternative school, and then I also just do outreach on the streets, going out in the woods, finding people who are in active use, going to the Brockton Fair, finding people who've maybe come from surrounding towns, and I work with High Point Treatment Center, and I educate people who are in treatment at the Men's Addiction Treatment Center, which is the 30-day Section 35 program, as well as the voluntary program, and I oversee the clinicians at MATC, the Men's Addiction Treatment Center, the Brockton Addiction Treatment Center, and the Castle, which is adult.
So the High Point MATC program that we have here in Brockton, I think it's on the south side.
Yep.
Meadowbrook
Road.
Yes, you work Road.
Yeah.
That's a really important program as an outreach for families who may find themselves having to deal with an addiction. You had mentioned something about Section 35.
Yep.
Can you kind of educate us as to what that really means?
A petition for a Section 35 is a civil commitment, an involuntary civil commitment, for up to 30 days. And basically you'd go into the court system and you would petition for a Section 35, and a judge would hear your case and would either grant the petition saying that predominantly the reason that the person needs to be put into treatment for 30 days is because they're at risk for serious harm to themselves or others because of their addiction. So you do have to go through the legal process. The courts are involved.
So to some extent, the addict has certain rights that he needs to have basically taken care of?
Yeah.
Before, you just can't say, take my kid away and put him behind bars.
No, not at all. They have to be found to be a danger to themselves or others. A family member could petition for a Section 35, a police officer, the hospitals, and someone could petition for a Section 35 for themselves. But where we're really unique is of the 15 communities that were funded, I work for the city of Brockton. I can work with the city of Brockton really pretty much exclusively, but there's people coming from all over the state of Massachusetts, men coming, from Adams and Great Barrington and the Vineyard, who otherwise maybe never would come through Brockton. They now have the opportunity to get this education and to leave their treatment facility with nasal Narcan, which we'll talk a lot more about. But when we're talking about opiate addiction, it can be a matter of life and death, and it's not available as widely through the state.
What are opiates?
Opioids and opiates kind of get used interchangeably, but really they're anything that comes from the opium poppy or anything that's synthetically manufactured by a drug company, usually in the form of a painkiller. They're depressants. They depress and repress the central nervous system. Examples of them are things like heroin, morphine, and codeine, which come from the opium poppy, or Oxycontin, Percocet, Vicodin, that are all synthetically manufactured. It's also important to know that both methadone methadone and Suboxone, which are used to treat addiction in a form of maintenance, are both opioids. And you can overdose from any of them the same. So you could overdose from codeine the same way you can overdose from heroin. You can overdose from any prescription medication that's an opioid. So it's important for people to know that.
So to some extent, the treatment that is available to the addict is in itself an opiate, and
It is.
It's just interacting, I guess, with the brain a little differently.
Yeah, basically, it's in a maintenance form. The person's on a dose that allows them to function, go to school, go to work. It takes away a lot of the criminal justice aspect, usually because someone doesn't have to feed their habit. They're going into a treatment facility. Usually they're getting counseling and other, services that hopefully will work towards recovery.
And is this geared toward a weaning off of the opiate over a period of time? Is that a way to look at it?
Yeah, absolutely. Yeah. So it's really about keeping their cravings away and allowing them to, get through the process and hopefully get some treatment and, whether that's group or individual counseling, and work on the issues of their use, but they don't have to deal with the physical craving.
What is an opiate overdose?
Okay. So basically what happens are when we use opioids, whether we're using them to get high, an illicit drug like heroin, or if we're taking them as a pain medication for legitimate pain, basically, I go back to biology 101. Receptors are something in our brain that send messages, and opioids fit into the receptors. So if this is a receptor in our brain, opioids fit into the receptor. And we have 3 responses to an opioid in our brain. If we're in pain, it helps the receptor to send a message that we're not in pain anymore. Even if we're still in pain, we could get sick from it. Our body doesn't react well to it. We could vomit, or you get a very euphoric high. Now, what happens though is when you have too many opioids in your system, the receptors are too busy processing the opioid to do what they're meant to do, and that's to send a message through our body to maintain all of our vital signs, most importantly, to maintain respiration. So what happens in an opiate overdose is that someone doesn't get enough oxygen because that receptor is not sending the message, and the person essentially suffocates. So all of our vital organs that require oxygen, our heart, our liver, our lungs, our brain, our kidneys, they don't get the oxygen that they need, and they'll start to shut down. What's really important to know about an overdose is that it's a process. And what that means is that there's time to intervene and to save someone's life. A lot of times what we know about overdose is what we see on TV or what we see on the movies, and that someone uses, usually it's in a dark alley, someone injects heroin into their arm, they die. Boom. But that's not...
The ejection, they kind of get this relief and then
boom,
collapse.
But that's not necessarily how it happens.
That's the movies.
Right, that's very sensationalized. So what really happens is the person's slowly not getting enough oxygen. Now someone could use and then could shortly thereafter fall out into an overdose. Or someone could use and more commonly fall out into an overdose up to 3 hours after using, which is not something a lot of people know. What they've actually found in all the research that they've done are that most fatal overdoses happen in that 1 to 3 hour time period. Now, I think a lot of that has to do with the fact that people don't know they can overdose up to 3 hours after. They think they're okay. Maybe they do use with people, but then they go home and they go to bed and they're in their house or their apartment or wherever alone. Or maybe they leave a situation that's safe and they don't realize they could fall out and they fall out into an overdose. So it's important to know that an overdose is a process.
What would be signs of an overdose that, a family member, or if you're out in a club
Absolutely.
or a house party, what are the signs of an overdose?
Absolutely.
That we need to know about?
Certainly. The signs of an overdose on all opiates are the same. So whether it's an overdose on codeine or whether it's an overdose on heroin, it would look exactly the same. It would also look extremely similar to an overdose on benzodiazepines, so drugs like Ativan, Xanax, Klonopin, Valium. And it would also look pretty similar to someone who has alcohol poisoning.
Prescription drugs we can find in medicine cabinets.
Maybe if you're prescribed them. They're drugs that are prescribed usually for people who have anxiety, maybe have a tough time sleeping, that, maybe you have anxiety about going on a plane. Those types of things would cause you to be prescribed them, but they're also widely abused, and they're very commonly abused with opioids. Mm-hmm. So if someone had alcohol poisoning, or if someone had an overdose on opioids, or if someone had an overdose on benzos, it's all going to look pretty similar. The most common sign that someone is in an overdose is a blue tinge to their lips and to their fingertips. But what's important to know is that there's a whole host of symptoms that someone could have. For example, somebody could be awake but not able to respond. So people could actually be walking around, talking, turning blue and overdosing at the same time. That's not something that people often associate with an overdose, but it does happen.
Is that tantamount to like a zombie effect of somebody walking
you know,
around? I don't know.
It kind of can be, and when we talk about Narcan, it's been described to me as Night of the Living Dead, so it kind of fits.
Okay.
But someone's face would usually be very pale, gray, or ashen. If you were to feel their skin, it would feel really cool and clammy to the touch. Their pulse and their breathing would be slow, stopped, or erratic. They could be passing out. They could be in a very, very deep or heavy nod, which is, you know, that kind of effect that often is identifiable by someone who's abusing opioids, which is that kind of, I'm falling asleep, no, I'm awake. I'm falling asleep, no, I'm awake, that type of thing. So they could be going practically to the ground and coming back up, throwing up, foaming at the mouth, convulsing. They could also be making a gurgling, choking, snoring kind of sound. It's very loud, it's very distinct. Basically, the person's aspirating. But someone who's in an overdose could be doing any of these things in any combination. So it's important to know that there's a whole host of different symptoms.
So how would I, or anybody out there who's at a party and you look over in the corner on the couch or the chair and there's Joe or Mary kind of just laid back, you know, and, you know, it's 11, 12, 1 o'clock in the morning, you think they're just, you know, snoozing. You know, what should they really do? How would they kind of know whether or not they're just taking a time out or whether they might be overdosing?
Absolutely. Well, over a period of time with this being something that happened, they have actually found that doing the sternum rub is one of the most effective ways as opposed to hitting someone or slapping someone. And what the sternum rub is you take your knuckles and you rub them up and down the person's breastbone. Push down hard. It's a really uncomfortable bone-on-bone action. And if they don't respond to that, they're not going to respond. If you can't reach the breastbone because maybe someone's got a lot of layers on, you can do above the nose, under the nose and above the upper lip. Same thing, push down hard, it hurts. If they don't respond to that, they're in an overdose. And another thing—
So you're, in essence, inflicting some pain,
well, yes,
but in the hopes of, you know, making sure the person isn't overdosing.
Absolutely. That hurts. You know, sometimes I'll do 5 and 6 trainings in a day and I'll be driving home and I'll be like, what did I do to myself? This really, really hurts. And for whatever reason, it's a different type of pain. So it usually should help bring someone out of it. If you do that and you're still not sure, what you can do is say the person's name loudly, you know, tap them on the shoulder and tell them that you're going to administer Narcan to them, which we'll get into. But for anyone who has any self-control over the matter, they're going to respond to you and they're going to tell you that they're fine, you're not going to administer Narcan to them. So those are 2 big things that you can do, you know, as opposed to just, you know, trying to feel for a pulse or whatever. These things, if they don't respond, they're not going to respond.
And at that point in time, the person is probably into an overdose.
Probably in an overdose, and we need to do what we can to save the person's life.
Oh my God! Guys, Natalie!
What?
She's okay?
She's fine.
She's fine, you know?
She doesn't look fine.
She looks like she had 1 too
Check
many.
her pulse to make sure she is fine.
Yeah, just.
She's
You know what?
just
Actually,
sleeping.
someone get me a marker.
No, she looks like a dummy.
Yeah, she'll sleep it off. She's fine. She's fine.
She just needs a good night's
We
sleep.
should call an ambulance. She
No,
looks
she's
not calling
fine.
an ambulance.
She looks incoherent. We need to
Incoherent?
call
She
No,
looks like
ambulance.
she's
She's
passed out,
fine.
dude.
What did she have?
She looked like
You know how much you can
she
use
had
that?
a couple pink ones and then a couple
No,
orange
we need
ones.
to call an ambulance.
We
because
all
she's
did.
alcohol.
But it's
and pills.
fine.
We don't need to get in trouble.
I'm okay.
You're fine.
We don't need to get in trouble so you can hear because you're
We'll
careless.
just drop her off at her house. I'm not trying to get in trouble.
Thanks a lot.
So in the event of an overdose, one of the most important things to do is to call 911. And when you call for help, it's really important to mention that the person is not breathing. Because in the event of an overdose, someone's not breathing.
Can I interrupt there for 1 second? Certain times people feel that if they call 911, they're going to become involved and the cops are going to come in. I mean, what's the myth behind that? You know, I mean, aside from trying to save the person who's overdosing, obviously, but you know.
Well, usually the job of the police is to secure a scene. And what people are afraid of is in the event of an overdose that the police will come, that there will be arrest made. And It's a possibility, but there are things that you can do to limit police involvement. If people are afraid that they don't want the police to come, that's not a reason, though, to not call for help.
Obviously.
One of the things that you can do is you can call the fire department directly or the ambulance company directly. For example, Brockton has a contract with American Medical Response.
Yep.
I could call them directly. The fire department and the ambulance will come together, and the police won't come to the call. But it's important, regardless of who you call, to say that the person is not breathing, because that's what's happening.
Right.
You don't need to say the word overdose on the phone. In a lot of instances, that will actually be something that can bring police, because now, in addition to it being a medical emergency, it's also a law enforcement issue.
Right.
Another thing that's important to know, if you ever have the option of calling from a landline or a cell phone, you always want to call from a landline. A cell phone goes to the nearest police barracks, so you're going to have to wait for them to transfer you to the local 911 dispatch. It wastes crucial time.
Crucial seconds and
Absolutely.
minutes. Right.
So if you have the option, call from a landline.
Okay.
But if I found someone who's fallen out into an overdose and I need to go and call 911, I need to go unlock the door, I need to go grab my Narcan, I need to leave them for any reason. If I leave him flat on his back, he's at risk for throwing up, foaming at the mouth, and then having it slide back down his throat and essentially him choke on his own vomit. Nobody should die that way. So I need to put him in a position where he's not at risk for further harm. And so that's the recovery position. Most people who you're going to find in an overdose are probably going to be in some form of lying down. So if they're flat on their back, what I need to do...
If they're not lying down, sitting in a chair, should they be...
Yeah, get them flat on their back.
Flat on their back? Okay.
Because when we talk about doing what we need to do to save someone's life, they should be flat on their back, okay? But I need to go and unlock the door so that the paramedics can come through, and I can't leave him like this. So what I need to do is put him in the recovery position. And basically all that entails is rolling him up over onto his side. Now, when I roll him up over onto his side, the most important thing is that I make sure that this top knee is flat on the ground. That acts like a brake. So if he were to try to roll out of the position, if he were to go into convulsions, any of these things, he actually can't get out of this position until he's strong enough to pull himself out. But I don't want to leave
Which would be a recovering
yes,
side.
exactly.
Okay.
That would be a good thing. So I want to make sure an arm's out flat. Take the other hand, put it on the upper arm, make sure that his mouth is open and pointed downward. This way, if he's gonna throw up or if anything's gonna happen, gravity's gonna take care of it. But for everything else, when we talk about saving someone's life, they should actually be flat on their back, which is really important to know.
So that's a recovery position,
That's if you're
allowing you to, if you're by yourself and you can't say someone call 911, get the door open,
Yeah.
this is the way for you to ensure that he's not going to basically choke.
Yep, that he'll be safe while I go and do that, so I can come back
And come back and
and take care of him. Exactly. So when we talk about saving someone's life in the event of an overdose, the most important thing to do is to rescue breathe. And a lot of confusion comes with, do I do CPR? Do I rescue breathe? What does that work? We just do rescue breathing. And basically what we need to do is get oxygen to the vital organs, etc. So what that entails is making sure there's nothing in his mouth. So if I saw anything solid, I'd use my pointer finger, make a hook, pull it out. If it was kind of liquidy, because people do foam at their mouth, you could just roll them over onto the side, kind of let gravity take care of it, okay? So while they're flat on their back, I've made sure there's nothing in his mouth. I'm gonna tilt his head up, I'm gonna pinch his nose, I'm gonna put my mouth over his, I'm gonna give him 2 deep, slow breaths. I wanna see the chest